Hey guys, want to make a quick video today about massage guns, okay? We have a lot of clients and patients that come in and say, hey, you know what, I've been having, let's say, shoulder issue, and I've been using my hypervolt or my theragun, and I've been doing my chest and my delt and my bicep and all that, and some people say they love it, some people say it helps them sleep, other people say, it's not really doing much for me. So I wanted to make a video today about what's going on when we use a massage gun. Is it worthwhile? Is there a way to do it correctly or not? Kind of our approach to percussion massage or massage guns. Okay, so when I refer to percussive massage, I should say, I'm referring to things like the hypervolt or the theragun. I'm going to kind of lump all those in together. Now, this technology is not new by any means. These types of machines have been around for years and years and years. They've just been branded more recently to be a little more sleek, handheld. The battery lasts a long time. You don't have to plug them in or anything. So they're very convenient nowadays, and which is why I think they're becoming a lot more popular. Now, in terms of what they're doing, we are essentially, when we turn our massage gun on and we, hit the power button, it essentially starts vibrating like this, just back and forth, pulsing motions. This one has 3 speeds that it can go, so the third speed is obviously the fastest. The first speed is the slowest. Essentially what we're doing is we're putting that massage gun into the belly of a muscle that's kind of bugging us, let's say. We'll go back to the shoulder example, okay? So if my shoulder's bugging me, maybe I put the massage gun kind of in my pec, my bicep, my delt, my traps, muscles that I think might be playing a role in why my shoulder's hurting me, okay? Now when we do that, the main mechanism at work here is we are kind of communicating straight to the brain, because the brain has mechanoreceptors deep in the skin that tell it, kind of what's going on at the skin surface, okay? So if there's a vibration type feeling or any sort of like pressure being put into there, it sends a signal to the brain, one, to block pain temporarily, okay? So that's why things like massage and dry needling and even massage guns in a temporary, short window of time tend to work in terms of pain relief. We're telling the brain, hey, stop worrying about the shoulder pain. Let's kind of almost like distract you with this other sensation. And in the short term, that works really well for getting rid of pain, okay? The bad side of that, or on the other hand, we only get rid of the pain very temporarily. So let's say I have, my massage gun on here. I'm like, oh, that feels so good. My shoulder feels great now. It won't be very long before, more than likely, that shoulder pain kind of comes back. All right, and that's where these massage guns tend to fall short, okay? If we're looking for that short-term increase in pain perception, or even a little bit of, maybe a little bit increased mobility, these types of tools can be really, useful for that. But just know that they're not going to last very long, or that those effects aren't going to last very long. And there's more than likely an underlying, issue or reason your joint or your muscles or your shoulder, whatever it happens to be, is bugging you, okay? So I always tell people, we use these in the clinic only because, as people lay down, we're getting ready for some more hands-on therapy or even for, like rehab, things like that we do a lot in our clinic. I find it beneficial to very quickly, kind of bring some awareness to an area, bring a little bit of blood flow in there, and kind of make the patient feel good and relaxed before they jump into something like that. Most of the effects here are at the brain level, okay? So there is some studies out now, and I won't quote any just because I don't have them memorized specifically, but that shows some changes in blood flow locally to the area that a massage gun has been used in. But what we do know is that we're not really changing tissue, we're not breaking up scar tissue. None of that is really happening when we use these. And so, like I said, a lot of the effects are very transient, very short-term, very brain-based. And I think there's value to that as long as we understand their place in rehab, okay? So this does not take the place of a chiropractor or physical therapist, performing rehabilitation on you. It does feel nice. It's probably a good thing, if you like how it feels and it, helps you relax before you go to bed, I tell people go ahead and use it. There's nothing inherently dangerous here. Now, obviously, we'd like to stay, on muscle tissue. We don't want to be, going right off of a bony protuberance or anything like that. But there is a good way to use it. And obviously, the more you know your anatomy, the better you will be with this thing, okay? There's not a ton of technique here. You can do different, stripping and, myofascial type techniques with the gun. But I usually tell people, stay on the muscle tissue itself. Go to tolerance. If you're feeling itchy or kind of feels uncomfortable, then, you're free to stop. I would say a lot of the benefits are going to happen in that short window. So it's only going to be a couple minutes where this thing is really, truly doing much. After that, we're going to kind of maybe enjoy a little bit of pain-free time, but then, pretty soon thereafter, it's going to more than likely come back. So just be aware of that. Know when and why to use these, and know when you need to be seeking, professional help for your issue that you're attempting to solve with this. Okay. If you guys are having issues like this, maybe you're using your massage gun on your shoulder, like I said before, and your shoulder's still bugging you, feel free to reach out and make an appointment with us. We'll be happy to give you an evaluation and give you a plan of treatment from there. I will see you guys in the next one, and thank you.